Hello, my name is Margarita Watkins and I will be demonstrating how to assess skinfold measurements. You will require a skinfold caliper and a washable marker. Locate and mark all sites using anatomical landmarks before measuring. All measurements should be taken on the right side of the individual's body. The tricep mark should be found on the posterior midline of the upper arm, halfway between the acromion and the allogram process, with the arm held freely to the side of the body. Mark the subscapular 1 to 2 centimeters below the inferior angle of the scapula. The chest mark is found 1/2 the distance between the anterior axillary line and the nipple in men, or 1/3 of the distance between the anterior axillary line and the nipple in women. The thigh should be marked on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease of the hip. The superiliac is found in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. The abdominal mark is 2 centimeters to the right of the umbilicus. The mid-axillary mark is on the mid-axillary line at the level of the xiphoid process of the sternum. 1 to 2 seconds after releasing the scissor grip, the skinfold measurement should be recorded to the nearest 0.5 of the millimeter. With the left hand, firmly grasp the skinfold 1 centimeter above the site to be measured. Place the thumb and index finger approximately 3 inches apart on line that is perpendicular to the long axis of the skinfold. Then pull the skinfold up and away from the body. It must remain elevated throughout the measurement. With the right hand, hold the caliper with the dial facing up. Place the jaws of the calipers perpendicular to the fold 1 centimeter below the fingers and halfway between the crest and the base of the fold, and release all pressure on the scissor grip while maintaining the caliper perpendicular to the skinfold. Use the left hand to grasp the skin and the right hand to hold the calipers. The abdominal site is a vertical fold. The superiliac is a diagonal fold. The mid-axillary site is a vertical fold. The chest site, or pectoral, is a diagonal fold. The tricep site is a vertical fold. The subscapular site is a diagonal fold at a 45-degree angle. The thigh site is a vertical fold. A minimum of 2 measurements need to be taken at each site. If the duplicate measurements are not within 1 to 2 millimeters or within 10%, the site must be retested. Skinfold measurements should be taken in rotational order. This allows sufficient amount of time for the skinfold to regain its normal thickness. The equations for body density for both men and women are illustrated below. Sum of the 7 skinfolds refers to the 7 sites: chest, mid-axillary, triceps, subscapular, abdomen, and superiliac and thigh. The means of every site are added and inputted into the equation. The subject's age is also taken into account. Body fat percentage is calculated via 2 equations, Prosic and Siri. Once body density has been found, it can be inputted into the equation. Thank you for watching.